The H200 wireless has been out on the market for a few years now, yet some of you aren't convinced it's any different from the legacy system. Today, that's all going to change as I walk you through all of the features and benefits of the H200 wireless. First things first, it's wireless, but you already knew that, so now that we got that out of the way, let's dive into some of the cool features that really distinguish the products. The most obvious visible difference is the control unit. While the legacy system was state-of-the-art when it was first introduced 15 years ago, times have changed. The control unit now hasn't only shrunk, but it's akin to a wearable, storing parameters and programs, as well as keeping usage logs, providing complete transparency to the clinician on how and for how long the patient is using the device. You can connect the control unit to the clinician's programmer, and suddenly a whole world of possibilities opens up. You can set up individual patients, store parameters, and customize programs. Now, let's roll back the clock and remember how we used to set up patients on the legacy system. Pressing the plus, minus, and on-off buttons simultaneously, if you could do it successfully the first time, would put us into clinician's mode. From there, the analog adjustment knob was used to set stimulation levels. Now, a clinician treating with the wireless would already have the stimulation settings stored and could begin treating the patient immediately. Quick setup time and ease of use are the key drivers for clinicians upgrading to the wireless. We've entered clinical mode by pressing plus, minus, and on-off. All trimmers should be set to 0, and the thumb lever placed just slightly above the midline. Setup starts with the extensors. Press trigger to initiate stimulation. Those dots on the screen indicate that the stimulation is active. If necessary, use the plus button to raise the stimulation duration to a level 6. Using a flathead screwdriver, you can adjust the trimmer, turning it clockwise to increase stimulation intensity. Turn it slowly until the desired movement is achieved. Press trigger to turn off the stimulation. Now, we'll repeat that process with the flexors. Select mode, which will bring up the flexors. Remember, we're still in clinician's mode. Bring the duration back down to 0. Press the trigger button and increase the duration back to 6. Typically, the flexor stimulation level is lower than the extensors. Adjust the flexor trimmer until the patient's hand closes using your free hand to keep the thumb from bending in the way of the index finger closing. The legacy does not have separate THENAR controls, but rather a bifurcated lead that shifts current between the FPL and THENAR electrode based on lever position. With setup complete, you're ready to treat the patient. Turn off the control unit and then turn it back on to access the treatment modes. You can select the desired program by pressing the mode button. Let's start with grasp and release. With the wireless, you'd simply select mode A on the programmer, but with legacy, you'll need to navigate to the exercise by repeatedly pressing the mode button. Start with the top timer trimmer all the way to the left. Press trigger to start the flow of stimulation, then ask the patient to reach for an object when their hand opens. Notice how he doesn't have enough time to reach the object before the hand begins to close. To maximize interval time, turn the trimmer clockwise. Now let's try it again. He still doesn't have enough open time. Now, due to his limitation, clinicians typically modify the exercise by bringing the object closer or simply by handing the object to the patient. With the wireless device, this wouldn't be a problem since we can increase the extension time up to 15 seconds. In the wireless device, we have the option of using the test mode, which gives the clinician complete stimulation delivery autonomy. We can control the precise timing of the extension and flexion, customizing it to the task in front of us for every repetition. This allows us to work with those patients not yet ready for regular repetition of an activity. This was an example of how to set up and treat a patient with the legacy H200. Now, if you'd like to further customize the control unit or set up a personal program, you'll need to access the configuration mode. This is done from the off position. Now, press trigger, mode, and on-off simultaneously until config shows up on the screen. Remember, this is different from the clinician's mode, so it's another 3-button combination you'll need to remember. From here, you must scroll through all the programming options to change a personal program, check the use logs, or customize settings. In the clinic, the use logs is a cumulative clock and not patient-specific, so the clinician needs to reset it each time or use a stopwatch. It's not very convenient, but remember, it was state-of-the-art for the time. The wireless system logs each session per patient, providing the clinician complete transparency on training time, dosage, and compliance. The H200 is appropriate for patients who present with a flaccid or high tone. Leveraging the principle of reciprocal inhibition, the H200 can be extremely effective when treating high-tone patients. The legacy H200 has 3 fast modes, 1, 2, or 3, which are determined through the config window. Remember, that's plus, minus, and the on-off button, and then activated by long pressing the trigger. First, put the control unit into clinical extensors and activate the stimulation. The top trimmer can be used to increase or decrease the pulse rate. Generally, fast 3 with the trimmer on position 5 works best. Now with the wireless H200, simply go to program G, neuromodulation mode, and start the treatment. Okay, let's take a minute and look at the list of key differences between the legacy and the wireless. First, it includes a HIPAA-compliant database. Wireless, yes. Legacy, no. Individual activity and compliance tracking. Wireless, yes. Legacy, no. Settings saved session to session. Wireless, yes. Legacy, no. FES set digitally. Wireless, yes. Legacy, no. They're analog knobs. Independent THENAR settings. Wireless, yes. Legacy, no. Designed for ADL and therapeutic interventions. Wireless, yes. It even has the enlarged FPL. And the legacy, no. Includes a neuromodulation mode. Wireless, yes. And legacy, no.